Friends, good afternoon. It's indeed a pleasure to have this event today, and we have amongst us Dr. Jennifer Sandoval, a faculty from University of Central Florida. Now, University of Central Florida is one of the largest university in the US. 62,000 students by any yardstick is very large in US universities. We are happy to share with you that I visited this university last June, and such a sprawling campus. We had a very successful meeting with the provost and about 5 to 7 deans and a number of professors, and that meeting actually resulted into signing of MOU with the University of Central Florida, and in order to have a number of activities, faculty exchange program, joint research programs, exchange of students, and so on. I'm very happy that today Dr. Jennifer is here, and she is actually door-opening visit, because this is the first visit from the UCF to us. We welcome you. Dr. Jennifer is actually visiting for a short period. She reached here yesterday and had one round of discussion with the director of ASM, Dr. Saklani, and also with Dr. Ogra, who is looking after the APJ School of Mass Communication and Journalism. Today she is spending time with us. In the morning she had a meeting with the faculty members of our Faculty of Mass Communication and Journalism, and discussed various prospects of collaboration. The topic is exploring international fertility tourism, a case study of surrogacy in India. As you all know, that this topic is a burning topic which has not only the medical implications, use of technology, like we call it ART, that is the assisted reproductive technology, and IVF is a technique which is now quite widely accepted. Before I invite Dr. Jennifer to give the talk, I would like to just give a very brief introduction. Dr. Jennifer Sandoval brings her experience as a mediator, project manager, trainer, and consultant to the classroom and her research program at the University of Central Florida. She is a faculty there. She holds a PhD degree in culture and communication from the University of New Mexico. I was just talking to you. I'm pleased that the University of New Mexico is actually quite well known in certain areas. And this culture and communication is one of the key departments of University of New Mexico. She comes from California, the Silicon Valley area, worked in LA, and moved to University of Central Florida about 2 years back, Jennifer? Okay. So she also holds a master's degree in a very interesting topic called dispute resolution from Pepperdine University School of Law. So with law background, she is actually quite capable of handling this particular topic. She actually, her research focuses on communicative elements involving interaction of identity, culture, and international health policy. Currently, she is continuing to investigate these elements in the context of fertility tourism, especially surrogacy in India. She also continues work with the community-based participatory research projects, focusing on health interventions in undeserved and underrepresented populations. Dr. Jennifer has published this research with her colleagues in the journals such as Health Education Research, Communication Monographs, and the Journal of International and Intercultural Communication. As you know that this is a very burning topic as far as the Indian society is concerned. On one hand, we see that there's a lot of disparity, sex discriminations which are being done, and on the other hand, there are certain ethical issues with the society, and different society perceive this problem quite differently. I'm very sure that this particular lecture will be very interesting, and you will be free to ask questions after the presentation of her talk. It is basically an interactive. I hope that you can welcome if they want to ask some questions in between. Feel free, interact, and let us make it a successful talk. Thank you.
Thank you very much for that kind introduction. It's a pleasure to be with you this afternoon. Thanks for taking the time in between your classes and your schedule. This is a little bit of a unique topic, and it may be unfamiliar or uncomfortable, so please feel free to ask any questions for clarification, or if you want to know more about the research program that my colleagues and I are engaged in, because it's really very complex, and I'm probably only going to be able to scratch the surface, essentially, and give you an introduction into the project, and hopefully you'll find it at least a little bit interesting. Okay? All right, so some of the issues here with this ongoing study, we know that infertility rates have risen globally, so in the US, UK, Australia, here in India, and couples are looking for new ways to start families. Right? So we have this field of assisted reproductive technology, and its really core base is IVF procedures, in vitro fertilization. And one of the additional things that has become increasingly popular is to use the IVF procedure with a surrogate. Okay? And I'm going to explain some of these terms in just a moment. But basically, the study that I'm involved in with my colleagues, we're really interested in looking at what are the nature of the discussions around this topic. What does it look like internationally, difference from the way we talk about it in the US versus the way that the discourse is here in India? And what kind of impact is that having on families, on the women who are the surrogates, on the potential child, and also the way that the policy is framing this. Okay, so we'll talk a little bit about law and regulation, or the lack of that, in a few moments as well. Okay? All right, so some of the rationale for this study, as we started to look at the various research that's already out there about this kind of topic, we know that there's a significant amount of information about the medical process here, right? The actual science, the medical and health science behind IVF, behind surrogacy. But there's a lot less information about regulation in the global context. So when people are traveling from other countries, issues of immigration and citizenship become a challenge. And we look, particularly from my field of intercultural communication, about the way that people talk about things. So literally we're investigating the word choices that people use and the way that they market these kinds of services, the way that they tell their story, to look at what that impact might have on issues of gender, issues of globalization, and reproductive health. All right? Okay, so I'm going to give you a quick introduction into the process of surrogacy, because you may be unfamiliar with it, so that you know some of the terms that we use in this particular research. So essentially, there's a couple of different kinds. Surrogacy itself is not really a new concept. Certainly, when families have been unable to have children, they've sought other family members, maybe a sister or somebody, to help carry a child for altruistic purposes, right, to help out their family members. Now we have this growing field of commercial surrogacy, where people are being compensated for this service. So the idea is that an in vitro fertilization process is performed on a woman, and she should have no genetic link to the embryo, to the fetus that she carries, meaning it needs to be completely the genetic material from the intended parents or international banks where they may have purchased the genetic material. Certainly, there are probably situations where people are exploiting that and not following that guideline, but that's the idea. So it's generally considered a higher risk pregnancy when a woman has an IVF transplant. There's considerable pre-health concerns in terms of preparing a woman's body for the IVF transfer. It's very hard on her body in a lot of ways. So one of the interesting aspects of this for the site of India is that a lot of the clinics here are serving about 50 to 60% of their clientele from outside of India. So they're seeing people come to hire surrogates and use these services from the US, UK, Australia, Germany, Israel, Japan, also very popular. And so there's a global context for this discussion and a global conversation about what this means in terms of people coming basically as a part of medical tourism, right? So there are companies that set up, come and get your medical treatment and we'll put you on a bus to see the Taj Mahal and you'll get the whole Indian tourist experience while you're also here receiving treatment. A couple of reasons for this. Certainly there are these services available in the UK and the US. They tend to be about a third of the cost here in India. And so people are looking for cheaper options because it is an incredibly expensive procedure for anyone. And also a lot of people feel comfortable with the medical care that they receive here in India, at least based on the interviews that I've done so far. This has gained a little bit of traction in the media. The area that I'm generally based in when I come to India is the state of Gujarat, and I stay in Ahmedabad and travel to Anand, where the Amul dairy is. That might help you place where that is if you're unfamiliar. Because there's a very large clinic there, run by Dr. Naina Patel, and she's reached global status with her clinic. She's been on the Oprah Winfrey Show, which made it very popular in the US, and also been featured in Newsweek magazine, Times of India, NDTV, did a story. There's a number of different documentaries where people have come to interview. And right now, the BBC is actually out there producing a documentary as well. So there's increased media coverage for this. So when couples in the US decide to Google surrogacy and figure out where they can avail themselves of these services, oftentimes they're led directly to the Akanksha clinic. People in the US are very unfamiliar with that particular region, and generally the whole concept and the way that it's processed. So in addition, there have been a number of companies that have popped up that are brokering these transactions and preparing the trips for the couples, all right? So we see kind of an increase in discussion, particularly in the US, about whether or not it's appropriate to pay somebody outside of our own medical system to do these procedures and what it means to hire. A lot of times they may never meet the surrogate, or they may have a lasting relationship, and that becomes very complicated. So there's a lot of complex features in this relationship between the intended parents, that's what we call the couple who is coming to have a baby, the surrogate themselves, the woman who's going to carry the baby, and then the potential child, right? The child or children that are going to be produced from this relationship and transaction. It's incredibly complex. So we wanted to investigate some of that to get a better idea of what this looks like. All right? This is just a really brief history of some of the aspects of this. IVF is not very new, but it is incredibly common as an option for people. So particularly in the US right now, we have a really big discussion happening about the fact that women are waiting what medical science is saying is too long to start a family, right? So they're going to college, they're going to grad school, they're having careers, and waiting until their 40s to start a family. And so that's reducing their ability to do that easily or naturally. So this is incredibly common in the US now for middle, upper class, educated people to try to use an IVF procedure. It's not always successful, and so then one of the later things that they might seek out would be the idea of surrogacy itself. Okay? You can hire surrogates in the US as well. It's very complicated in terms of the legal contracts and the various legalities of it from state to state in the US. So the way that the rights might be in California would look completely different from the way that parents would have rights to the child in Florida. And one of the biggest concerns for people is that in the US, we have a lot of parental rights for anybody who gives birth. So even if the woman is not genetically linked to the baby itself, potentially in some states she could still claim motherhood of that particular child, and then the parents are concerned about that coming back to be an issue after they bonded and attached to this baby. All right. Additional things that are interesting about the Indian context here, the way that fertility tourism and surrogacy is marketed in the US, there's a lot of statements about it becoming legal in India in 2002. It's not illegal, we know that, but there's not actually a law yet. Any possible treatment or service that you might use. It's a very lengthy, valuable document that's trying to protect all of the parties involved and also think about the potential problems that could exist. That was turned into a bill in 2008 and then revised in 2010, but it's still not been passed by Parliament. So we're 3 years out from the latest version of it. It continues to get longer and more complex, and we see additional case studies in the media about particular issues. A couple of cases that were really big here, I don't know if you follow this at all, baby Manji from Japan, maybe you saw it in the news. What happened was, a couple came to the Akanksha clinic, hired a surrogate, were going through the process, and they divorced in Japan while this woman was pregnant with their baby. And so that became really complicated. What do you do? Who has parental rights? The mother, the intended mother, no longer wanted anything to do with this baby after their marriage ended, and the father wanted to still go forward and bring this baby home. And there was a lot of irregularities in the way that the paperwork was done. It became very complicated. He was not able to just have fathership, paternity of the child, even though it was his genetic offspring right away, and ultimately had to bring his mother, the grandmother, who came and then adopted the baby. And then they were able to bring it back to China. So through the course of the whole situation, the baby was cared for by maybe 6 different women. So the surrogate took care of it for a while. Then there was a wet nurse who came in. There was other additional care, and then the grandmother. And then when they went back to the States, other relatives that took, to Japan rather, other relatives that took care of this particular baby. And that was one of the first cases where people decided, we have some issues that we actually need to think through here, particularly with regards to the bureaucracy, paperwork, immigration. Another interesting case where a German couple came, and the complication is that if surrogacy is illegal in your home country, it's very difficult to bring the baby back. And they had twins, they were unable to bring them back to Germany. The child basically had no citizenship. India said, well, it's not an Indian child, so it doesn't have citizenship here. Germany said, this is not a procedure, that's okay, so it doesn't have citizenship here in Germany. So now what do you do with this baby from Germany to take care of them? And it took almost 3 years for them to figure out how to get their children home and for them to have German citizenship, even though both of their parents were German and they were complete genetic children of this couple. So you can see where the complications just expand, right? Really multi-layered issues, a very complex issue that we can't really simplify in a lot of terms, and we have to kind of think complexly about these issues. So some of the key concepts that my colleagues and I look at in particular is issues of identity, right? When such a complicated process is used to construct a family, what is the identity of the child? What is the identity of the family? How is that story told? And how does that differ from some of the more traditional ways that we might be used to, and even things like international adoption, that now there's been lots of work created about that situation, and we have pretty extensive research in terms of what that looks like for families, and it's completed a life cycle. We have adult children of international adoptions who talk about that experience. We're not quite there yet with the issue of surrogacy. We don't have really vocal adult children of this process to talk about how that's affected their identity, so that's something we'll continue to look at in the future. And we're really interested about the messages about this, the media coverage, how people talk about it, what people know about it, the social and political implications based on cultural ideas of family, of health intervention. It's a pretty significant decision for people to make to engage in this. And then in terms of the policy, whose rights are most protected, right? So we want to look at, are the international intended parents privileged in the relationship? Do they tend to have a little bit more rights, more access, more protection in the situation? There's obviously lots of potential for exploitation of multiple parties and stakeholders. And so we're really interested in looking at cross-culturally what the policies look like, how they differ, why somebody might prefer the policy here in India as opposed to going through this, say, in Florida, where I teach. Okay. So these are just some of the research questions that we've engaged in. It's starting to expand cross-cultural investigation because this is an increasingly popular practice in Thailand now, also Latin America and the US. We have a new issue with regards to domestic surrogacy. The women who are working most commonly as surrogates in the US are what we call army wives. Okay, so the women who are still at home or on the base while their husbands are deployed overseas. Because maybe you're familiar, our deployments have been very long for these soldiers the last couple of years, so they may be gone a year or two, and these women are able to make basically an annual salary while they stay home with their own kids. The US Army is not really happy about it because they provide health care for these women on the base, but they legally can't ask if it's their child or not. So they feel like they're getting really good free health care for something that they're making money off of, and it's become very controversial. Right? So then another part of the project is actually working with the surrogates themselves. One of the reasons why I'm in India right now is a colleague and I are spending some time at the surrogate house out there at the clinic. So this particular clinic that has become known as the birthplace of surrogacy in India has about 75 surrogates in their surrogate house at any given time, which is a pretty significant number of pregnant women living together, right? So it's kind of a unique situation. They're being trained in terms of stitching, embroidery, some computer skills, some other things while they're there, because really there's not much else for them to do while they're waiting for the baby. It's kind of a confined time for them. They're usually far away from their family and communities. So that's one of the things that we're looking at right now is their experience in collecting their narratives, right? What are your motivations? What is it like to do this job? What kind of connection do you or don't you feel to a baby that's not genetically yours, but that you carry? And then, of course, looking at the guidelines. So my primary method of research is qualitative, meaning I do qualitative in-depth interviews, and also ethnography or participant observation. So the first phase of this project has been interviewing a number of stakeholders to kind of get a sense, it was more exploratory, get a sense of what is the big picture here, how can we put all these pieces together, and now we're engaging in more of the observation by going to the surrogate house and spending a couple of weeks with them there. All right. Most of the interviews have been either one-on-one or small groups. There have been a pretty lengthy list of types of people. Because it's so multi-layered, we really wanted to make sure that we were getting perspectives from all of the possible people involved. There are certainly some categories missing here, and we have future research to engage in. But we've definitely talked to healthcare providers, right? So the doctors who are setting up these practices, who are performing these services for people, to talk about how, what that looks like to have international patients, how this practice is changing their own healthcare practices, and even some healthcare providers that are generally opposed to the whole relationship and have some perspectives on it that are very strong. Okay? Also looked at what we are calling commercial providers, so these third-party agencies that have popped up as these brokers of the transactions who will help you travel to India, get you connected to a doctor, help you find a surrogate, and just kind of be a manager of the process, which is a pretty interesting business in and of itself. Also, some individuals from cryobanks, or these banks where people can go and purchase the genetic material. And also took some time to talk to government and health officials. This was a couple of years ago, and there have been some interesting updates both with the guidelines and also with how you travel here. So recently, there's a whole brand new visa that you get just for surrogacy. So if you're coming to India to use these services, you apply for a very different kind of visa so that they have more information, more medical information, as opposed to just coming in as a tourist to visit. And then, of course, surrogates from multiple locations. Also, a few intended parents, though that hasn't really been the focus of our research. There's a lot of research in the US right now that has already collected some of these stories about why people might choose this particular path and what brings them to India. So that's not our focus, but there's a lot of interesting stories. And we have talked to a few when we've been at clinics to find out how they found out about this particular clinic, how their experience in the process has been. Interestingly, one of the people that we interviewed was back for her second time. And then finally, some community organizers to get some perspective, local perspective. Particularly for me, I'm obviously not going to speak for the Indian experience, and we wanted to know kind of what the general thoughts and feelings were about this kind of practice. We're a global team. One member is from Denmark, I'm from the US, and our other partner is actually here in India. So we're trying to put a global perspective on this issue. So I'll give you a sense of some of the current findings. This is a longitudinal study, so we're still working on the nuances of this and making sure that we're capturing as much of the story as possible. But some of the things that we've looked at is how is this process actually communicated? What are the ways that people talk about it? And there's three major categories right now as we are organizing it. First, we have medical intervention. So some doctors have very strong feelings about what this was for the couple. And they said this is like a prescription. They would prescribe surrogacy to people who had been unable to conceive any other way. One doctor in Mumbai had a very interesting term. He called the people who traveled here reproductive exiles. He said if they can't avail themselves of these services in their home country, they have nothing left but to come here, and they want a family so bad. And he felt very strongly that it should be a service available for them. So a lot of times they said, yeah, of course, this medically makes sense. We can still give people offspring that they're genetically linked to, which is something a lot of people care deeply about. And they feel like it is a bit of a win-win situation because of the commercial aspect of it. So obviously people are making money off of this, right, as they would in any tourism endeavor. And that's one of the big critiques in terms of who's getting the most commercially out of this arrangement, and how are the different percentages being negotiated. But it's certainly an opportunity. Obviously with these third-party brokers that are popping up, this is an entirely new business. There are a couple of law firms that are dedicated only to surrogacy in India. So that's a very specific aspect of law to have an entire practice dedicated to. And so we see a lot of opportunity for business. Also, as you'll see in a minute, the women think of it as a business opportunity for themselves, right? The surrogates say they're doing it to help. The doctors say they're doing it to help. The intended parents think of it as a gift when they're given that child. So it's, as much as they may briefly recognize that this is commercial in many, many ways, they always tend to want to bring the conversation, at least at the end, back to the idea that there's altruism involved, that they do this because they're a good person, that why wouldn't you want to be able to help a couple be able to achieve their dream of a family and some things like that. Okay? In terms of the surrogates themselves, 95% of the surrogates that we talk to say the reason they do this is for their own children. So that's one of the primary requirements right now, according to the guidelines, is that you are married and you have your own children already in order to be a surrogate. And they say, yeah, I'm here so that I can educate my kids, provide a little bit of a better life for them. They're going to make as much money as it would take them maybe 5 to 7 years to earn in another labor type job. And so they think that it's an important opportunity as mothers of their own children. So that seems to be the primary identity when we talk to these women that they want to focus on. Their roles as mothers in their own family, which also connects them to the intended mothers of the parents that are coming from overseas. They also talk about the fact that this is an opportunity. Usually most people talk about building a business with the money that they're going to make. So it's a significant amount of money in a short period of time. So they talk about using that money then to start a different kind of business back in their community so that it's longer lasting, right? So that it is actually building towards the future instead of just kind of a windfall of money that maybe gets spent a little too quickly. And then finally, again, back to that altruism, they all talk about the fact that they feel very good about the fact that they're able to provide this service for a woman who can't have children. Most of them talked about the experience. They couldn't imagine not being able to have children themselves and how difficult that must be, and they feel a lot of empathy and compassion for these women, and so want to think of it in that way, that they're truly helping somebody be able to do something that is very important in their own lives. That was a really important part of the conversation. And then finally, with regard to the law and some of the policy guidelines, again, it's continually being updated. So there are some things that are shifting right now in the version of the bill. In general, some of the things that we've found for some discourse analysis is that pretty much the doctors and the commissioning parents are the privileged parties right now in the regulations. They have a lot of say over anything from what the surrogate eats, what her diet looks like, all the way to exactly how much money she gets and when she gets it. The doctors are really managing the relationship, even when they're somewhat unprepared to manage the relationship. Some clinics are better than others at constructing the kind of system that allows for really effective management of this kind of relationship. The international stuff is still a gray area. It's very vague with regards to how to really manage these international couples and the immigration issues, the citizenship issues. Different offices are kind of handling it in different ways. Sometimes they're basically just filling out certificates in a way that will make it the quickest and most efficient, but may not actually be the most legally accurate. So that's a concern. And then looking at also what happens when there's a dispute about anything. So particularly with my background in alternative dispute resolution, I'm interested to see what clinics are going to start to put into place, because there's the potential for a lot of disagreement about things. Some contracts are very explicit. So if the woman is unable to have children after this pregnancy, because it's a difficult pregnancy and something happens in the birth, some contracts say she'll be compensated for that, which is controversial. Some contracts say there's extra compensation for twins, right? A lot of kind of interesting things that you have to think about in terms of the actual logistics of the healthcare intervention. Whether or not the couples get to decide some other things in terms of the process, whether or not the surrogate can terminate a pregnancy, some other really difficult gray area issues that are not particularly addressed continue to be problems in some of the primary case studies. So we're also looking in general at the protection of the baby, right? And one of the things that's been revised in the guidelines now is that any international couple actually has to designate somebody locally here in India as kind of the guardian. So if anything happens where they can't come and pick up the baby for either a short period of time or something happens and they never make it, they've thought about the future of that baby. That's obviously a really difficult thing if people don't have communities here in India, which most of the people who are not of Indian origin certainly would be. So that's going to limit, if that becomes law, a lot of the couples, as far as we can tell. So generally, the idea, this is a really brief introduction to a really complex issue. There's a lot of things to consider, and we're really trying to consider the complexity of it and not simplify it and not say it's good or it's bad or any of these kinds of generalizations, but rather look at the implications and some of the paradoxes that actually exist in this relationship globally and locally for the people who are involved. And so we looked at some of the issues of free market enterprise versus the regulation, the idea of loss and gain, Especially for the women, they hand over the baby after the birth. They also gain possibly a big opportunity for their own families. Some conflicts between traditional values and modern technology, whether or not this is even something acceptable for yourself, for your family, for your community, and how other people might feel about the decision that somebody would make to start a family this way or to work as a surrogate. And other issues of exploitation versus empowerment. So we're going to continue to investigate this across a lot of different areas. Some of the family dynamics, particularly after working as a surrogate, is of interest to my local research partner here, looking at what is that like when she returns home after being gone for almost a year, engaged in this kind of work, and how does that change her circumstance. We're interested in the decision-making process, a lot of the cross-cultural experiences, starting to think about looking at this from a spiritual context and looking at some of the religious issues that might exist, the conflict and contract management, and continuing to look at policy engagement as this reaches other countries and what that's doing to international relationships. Yeah?
Can you throw some specific light on the religion aspect? That's quite interesting.
The religion aspect? Yeah, it's something that I actually had a long conversation with some of your colleagues today about looking at some of the intended parents actually request surrogates of a particular religion. They want a surrogate who's of their religion, which is kind of an interesting idea with regards to how we might embody religious practices and what that might mean, both logistically. So I give the example of some Americans don't want a vegetarian surrogate because they have this weird idea.
How is it related to the legal framework in terms of
How's the religion related to the legal framework?
Legal framework, as a part of legal framework? Is it acceptable? Is it not acceptable? Should it be part of
The contract?
the religion aspect?
You talked about the parliamentary bill which is under consideration.
Yeah.
That's the situation. We want to know about the legal aspect.
The legal aspect in general? I'm sorry, I don't understand your question.
Religious.
Yes.
Thank you.
Thanks for the